Greetings, future nurses. This is Nurse Ed Scholar here. Today we're going to dive into the realm of eye assessments. So I want y'all to join me, to explore the details of inspecting, palpating, and testing vision. So let's get started. All righty. So when we're gathering subjective data, we're going to uh, collect, crucial information from the client. And when we're trying to inquire about vision difficulties, we want to ask them about decreased acuity, any double vision, blurring or blind spots, pain to the eye, retina swelling, watery, or any other kind of discharge. Any eye-related symptoms, medication history, past eye problems, and you're going to ask them, hey, do you wear glasses or do you wear contact lenses? Okay, and all of this sets the stage for a comprehensive eye assessment. Now, moving on to like objective data that you would collect, you're going to inspect the external eye, okay, and the structures. From the eyebrows, you got your eyelashes, the eyelids. You're going to check for symmetry, ptosis, which is also drooping, um, exophthalmos, which is protrusion of the eye or like a bulging out, and then enophthalmos, which is a sunken eye. Okay. And also with that, as you're looking at the eye, you're going to make sure that the conjunctiva is clear, is the sclera white, the lacrimal apparatus, you know, you're going to look for excessive tearing, redness, of course, tenderness, swelling, and then, know that the cornea and the lenses are supposed to be smooth and clear. And so all of this is going to give you valuable insight on the health of the eye. Then, you're going to do some vision testing. Okay. We use a Snellen chart, a Snellen eye chart, to assess distance vision. So you're going to ask your client to cover one eye at a time and record their ability to read the lines on the chart. Now, understand, please instruct your patient to leave their glasses on and their contact lenses if they have them in. And then knowing that, when you do this, you are actually testing cranial nerve number 2, the optic nerve. Okay. And then note that normal visual acuity is 20/20. So, when we assess, near vision and confrontation tests, they're going to further scrutinize your client's vision. And, these tools help ensure a thorough evaluation. Now, confrontation and eye and test and eye movements. So the confrontation test, allows us when, we as nurses perform them to assess the peripheral vision of the client, and comparing it to the nurse's vision. You're going to evaluate the eye movements in the 6 cardinal positions. And when doing this, you are testing cranial nerves number 3, number 4, and number 6. Okay. This assessment ensures, the eye muscle functionality. As nurses, we're also going to test color vision. So the color vision test, you're going to use the Ishihara chart, which is a tool to detect red-green blindness. Now, this test is sensitive, but it does not discern discrimination of blue. Okay, remember that. But assessing our patient's color vision kind of broadens our perception of the client's visual perception. Okay. Then we'll move on to the pupillary reflex. So, when we're doing pupillary reflex testing and we're assessing the sclera and cornea, you know, with a pupil, we're looking for pupil size, light response. And then the sclera, we're looking at the color. A normal response to light and examining the sclera and cornea kind of helps us understand if there are any potential issues with the eye. So remember, a yellow color in the sclera may indicate jaundice or some kind of systemic issue. The cornea should be transparent, it should be smooth, but if there's any kind of cloudiness or specks, that could be from an eye injury of some sort. Okay. And, of course, we're going to use the ophthalmoscope. That'll help us kind of look at the external and internal structures of the eye. Um, we as, you as nursing students may or may not really get involved with this, but, we use our ophthalmoscope to look at the optic disc, the health of the retinal vessels, and the macula. But one thing that we do is and look out for is a red reflex when we shine the uh, the ophthalmoscope in the eye, because this actually ensures the integrity of the lens. Okay, that red reflex is definitely something that you should see during an eye examination of your patient. And lastly, one thing that we do, and I, have probably said before, it's important for us to educate our patients. We have to let them know the importance of regular eye examinations and to definitely report promptly to the primary care provider or the ophthalmologist if they have any redness, swelling, or drainage of any sort, from the eye. And, we really have to express that, well, I guess enforce that. I don't want to say enforce, but let's just say stress the importance of follow-up when patients are having issues with their eyes. Because, knowledge empowers our clients. And we provide a lot of people that knowledge that they need. So thank you for navigating with me, these eye assessments. Understand that these are overviews just to kind of give you the information that you need. Um, and realize that you do, play a pivotal role with your detailed assessments and maintaining the visual health or, depending on, your whole body system, the client's body system. We really help with the maintaining of our patient's health. And so please join Nurse Ed Scholar in the next video. Please like and subscribe. Um, and until then, keep honing your skills, keep practicing, because it's going to get easier, it's going to get better. And best of luck on your nursing journey.